Jeremy Morris, a British epidemiologist, conducted pioneering research in the mid-20th century that highlighted the importance of exercise for cardiovascular health. His studies, particularly those comparing the health of active bus conductors to sedentary drivers, demonstrated that regular physical activity significantly reduces the risk of coronary heart disease. Morris's work laid the foundation for modern exercise recommendations, showing that even moderate-intensity activities, like walking, can have substantial health benefits. His research emphasized that incorporating regular physical activity into daily routines is crucial for preventing chronic diseases and promoting overall well-being. Jeremy Morris's bus conductor study is one of the most famous and influential pieces of research in the field of epidemiology and public health. Conducted in the late 1940s and early 1950s, this study compared the health outcomes of two groups of London transport workers: bus conductors and bus drivers. Key findings. Study design. Morris and his team observed around 31,000 male transport workers aged 35 to 64, including bus drivers, conductors, tram drivers, and trolleybus drivers. The conductors were physically active, spending their days climbing up and down the stairs of double-decker buses, while the drivers were mostly sedentary, sitting for long periods. Coronary heart disease rates. The study found that bus conductors had significantly lower rates of coronary heart disease compared to bus drivers. Specifically, the annual rate of CHD was 2.7 per 1,000 for drivers and 1.9 per 1,000 for conductor. Severity of disease. Not only did conductors have lower rates of coronary heart disease, but the disease was also less severe among them. Conductors were more likely to experience milder forms of heart disease, such as angina pectoris, rather than more severe outcomes like myocardial infarction, heart attack, or sudden death. Statistical significance. The differences in coronary heart disease rates between the two groups were statistically significant, suggesting that the physical activity associated with the conductor's job played a protective role against heart disease. In addition to reducing the risk of coronary heart disease, Jeremy Morris's research uncovered several other significant health benefits of regular physical activity. Morris's studies indicated that physically active individuals tend to live longer than their sedentary counterparts. His research suggested that regular exercise could help prevent other chronic conditions, such as type 2 diabetes and certain types of cancer. Morris also highlighted the positive impact of physical activity on mental health, including reduced symptoms of depression and anxiety. Morris's study was groundbreaking because it was one of the first to use epidemiological methods to demonstrate the health benefits of physical activity. It provided strong evidence that regular, moderate-intensity exercise could significantly reduce the risk of heart disease. This research laid the foundation for modern public health recommendations that emphasize the importance of physical activity for cardiovascular health and overall well-being. Activities such as walking, stair climbing, recreational pursuits, and sports, both individually and combined, have been shown to reduce the risk of cardiovascular diseases.